Hi, everybody. This portion is on managing your medication, heart failure cardiac rehab session 5. My name is Lindsay MacArthur, and I'm the advanced practice nurse for cardiology here at the Heart Institute. So we shall get started. In terms of what I'm going to be going over throughout this presentation, I'm going to start with going over just the learning objectives from this session. I'm going to be reviewing all of the common heart failure medications. I'm going to be reviewing some important medication tips as well as some heart failure resources. And because this is pre-recorded, we will not have a Q&A session, but definitely don't hesitate to reach out to us if you have any questions after viewing this session. So for the learning objectives, we're going to be making sure they have a good understanding of the common heart failure medications and their purpose, making sure that you're able to recognize potential side effects, making sure you understand what to monitor with heart failure medications, and some general tips on how to manage your medications going forward. So in terms of all of the medications and heart failure, you can actually find all of this information in your heart failure patient guide as well. If you want to review any of the medications or circle or highlight any ones that you are on, you can definitely do so in your heart failure booklet that you should have received upon discharge. The first medications I'm going to touch on are the ACE inhibitors and the ARBs. Your ACE inhibitors, those are actually your angiotensin converting enzyme inhibitors is the other name for them. And your ARBs are your angiotensin receptor 2 blockers. So these are also referred to as ARBs, which you'll see me use that term more throughout the presentation. These medications are not used together. So they're used separately. So you wouldn't be on both of these medications at the same time. So the first medication is the ACE inhibitors. Examples of this are perindopril and ramipril. All of your medications with pril at the end, so PRIL. The purpose of these medications is to widen your blood vessels to lower your blood pressure. They help improve your heart function and your symptoms and help to lower the risk of hospitalization and heart attack. Common side effects of this medication are a cough, which can actually be quite bothersome, dizziness and lightheadedness, and an increase in blood potassium level. So while you're on this medication, and a lot of the medications I'm going to be reviewing, regular blood work is very, very important. So another rare side effect of this is actually angioedema, which causes swelling of the lips, face, and throat. And for this reaction, you would actually need to get emergency help right away. The next medication are those ARBs. Examples of this are candesartan, telmisartan, valsartan, irbesartan, and losartan. So it's all of your ARTAN medications, the ending ARTAN. Like I'd reviewed with some of the side effects with those ACE inhibitors, some people actually can't take those medications due to the side effects such as that coughing that I had referred to, or intense swelling, or that angioedema. These patients can take this medication instead. So this medication works by widening the blood vessels to lower your blood pressure. It improves heart function and symptoms and helps lower your risk of hospitalization and heart attack. Common side effects are dizziness and lightheadedness. There's an increased blood potassium level, so regular blood work is important, as well as a headache. The next medication is the angiotensin receptor and neprilysin inhibitor. A shortened form of that is actually ARNI, so you might hear that term be tossed around. The example of this medication is Entresto. This medication is actually to be used instead of an ACE inhibitor or that ARB medication. So you would not be on this medication and those medications I just reviewed. The purpose of this medication is to widen your blood vessels. It helps get rid of extra salt and water. It helps people live longer and reduces hospitalizations. And common side effects are dizziness and lightheadedness, dry cough, and an increased blood potassium level. So just like the ACEs and the ARBs, regular blood work is really important while you're on this medication as well. The next medication is the beta blockers. This is all of your All medications. So at the ending, they'll have the LOL. Examples of this are metoprolol, bisoprolol, and carvedilol. These medications help to improve symptoms. They help people live longer. They lower your blood pressure and heart rate, and they help lower your risk of hospitalization. Common side effects of this medication are fatigue and tiredness, dizziness and lightheadedness, as well as wheezing. The next medication is the mineral corticoid antagonists. The shortened form of this is we call them MRAs. Examples of this would be spironolactone and eplerenone. The purpose of these medications are to improve symptoms and help people live longer and lower hospitalization. This medication can cause an increase in your potassium level. And one of the things that spironolactone can actually cause is breast enlargement or tenderness. So we often do prescribe spironolactone first. And if a patient does experience this adverse effect of this breast enlargement or tenderness, they might get changed over to the eplerenone. Another medication that many patients who have heart failure are likely very familiar with is the diuretics or the water pills. The examples of this would be Lasix, and the purpose of this medication is to eliminate excess water by increasing urine production. This helps to reduce swelling in the legs, ankles, and belly and make it easier to breathe. Common side effects are dizziness and lightheadedness, a reduced blood potassium level, once again, really important for that regular blood work. Thirst and dry mouth is one of the big side effects. So, really making sure that you utilize some of those techniques in your booklet to help combat that thirst and dry mouth sensation, such as lozenges or even artificial saliva, such as biotin. And gout is another common side effect. There are other diuretics that we sometimes use that are listed there, but quite often it is the Lasix. Sometimes we do prescribe metolazone as well, and that's often used when you're quite fluid overloaded, and we'll add that on top of the Lasix. Then we have our SGLT2 inhibitors. Examples of this are all of your Flozin medications, so medications ending in Flozin. The purpose of these medications are to help the kidneys release more sugar into the urine along with fluid. They also lower your sugar levels and blood pressure, and they help aid in the diuresis for patients with heart failure. Because your body is releasing more sugar into the urine, really, really good peri-care is extremely important. So after you go to the bathroom, making sure that you're cleaning yourself well, because common side effects of this are urinary tract infections and yeast infections. Other side effects include low blood pressure and euglycemic diabetic ketoacidosis. And then we have our IF current inhibitors. The example of this medication is actually avabradine. This medication helps to slow down your heart rate, it helps people live longer, and it lowers your risk of hospitalization. In order to be placed on this medication, there is specific parameters. So you do need to have a heart rate that is greater than 70 beats per minute. And you also need to be in a normal sinus rhythm. So you need to have a regular heartbeat. This medication is not necessarily appropriate for everyone. Common side effects are visual changes with light, blurred vision, dizziness, headache, and high blood pressure. So, in terms of monitoring your medications, it's really important that you watch your blood pressure while you're on these medications because a lot of them do tend to fluctuate your blood pressure, your heart rate as well. So, some of the medications, such as the beta blockers, are used to actually lower your heart rate. Routine blood work, like I said, is extremely important. A lot of these medications do impact your electrolytes as well as your creatinine or your kidney function. So, it's really, really important that you have a physician to regularly monitor your blood work. And also daily weights is very, very important, especially with the diuretic medications, because those daily weights can tell you if you're putting on that extra water weight or not. An important note about beta blockers and diabetes, it's important that you monitor your blood sugars closely when you're on this medication and you do have diabetes. It may be challenging to notice the effects of low blood sugar, such as trembling or a fast heart rate. Beta blockers do not affect sweating or dizziness, though, associated with low blood sugars. It is really, really important that you do keep an eye on your sugars because some of the effects might not be as noticeable. One big thing to highlight, especially with the introduction of the SGLT2 inhibitors, is sick day management. If you are sick with nausea, vomiting, diarrhea, and or fever, you're at risk of becoming dehydrated. Dehydration can cause stress on your kidneys along with many other side effects. So in order to prevent dehydration and additional side effects, patients should discuss holding certain medications with their family doctor or cardiologist until they're back to eating and drinking normally again. Typically, these medications are your ACE inhibitors or those ARB medications, the diuretics, and the SGLT2 inhibitors. But these medications are to be resumed once you are no longer sick. For some important medication tips, when you leave the hospital, you want to make sure that you bring your old medications to the pharmacy with your new prescriptions so they can help you organize what you should be taking. You want to ask your pharmacist to check all over-the-counter medications before taking them. You can schedule a meds check appointment with your pharmacist. It's also important to make sure that you renew your medications before you run out. And if you are getting close to running out, that you contact a physician so that way you don't get stuck with having one pill left and no refills going forward. It's really important that you take your medications every day and do not stop taking them unless your doctor tells you to. These medications can actually improve your heart function and can help manage the symptoms. So they are very, very important. You can use a pill organizer, a box, or a blister pack in order to make sure that you're taking your medications as needed and that you're not missing any doses. You can also set reminders on your smartphone or a watch or pair with a daily habit. It's important that you always keep a list of your medications in your wallet or your cell phone and bring this list to all of your medical appointments. If you do miss a dose of your medication, you want to take the medication dose as soon as you remember. But if it's too close to the next dosing time, make sure you just take it as usual at the next dosing time. So you do not want to double up your dose to make up for a missed dose of medication. The key to managing your heart failure is you and your participation. It's really important that you advocate for yourself and being prescribed certain medications and seeing whether or not they're appropriate for you. So if you're not on some of the discussed medications, such as Entresto, Ivabradine, or the SGLT2 inhibitors, we definitely encourage you to speak with your cardiologist or family doctor about whether these medications are appropriate for you. If you go to our website, www.ottawaheart.ca, under patients and visitors and then tools and resources, you can find the heart failure patient guide under the section heart failure. You can also find the heart healthy living guide. There's also heart healthy eating videos as well. Another resource is that daily weight tracker tool. So it has the green zone, the yellow zone, and the red zone on it. And on the opposing side, it actually has a calendar for you to keep track of your weights. And we also have the heart failure transitional care nurse as an extra aid to support with education. And that concludes my presentation. Thank you so much.